Good afternoon, everybody. It's me, Dr. Azar, here with Shooter TV in Genesis Medical Center. We wanted to come live with you. Today is April 2nd, 2020. We're in the midst of the pandemic or epidemic with coronavirus 19. You see, we have some gear on. I wanted to share this with you, and we'll talk about this gear and why I have it on and why it's important for all our doctors that are in the front line fighting this epidemic in the ERs and the urgent cares. Wherever there's hospitals, there's people being seen with the COVID-19 cases, our doctors need to be protected, and we'll discuss this a little bit furthermore. The state of affairs, we have today, I think they just told us that there's over 1 million cases of COVID-19 across the world now. And just in the US itself, we have over 200,000 cases, and we've had over 5,000 deaths now, and it is increasing. So for us, it's very important to realize that this epidemic is coming close to home, and we're all on basically lockdown or stay in shelter at homes, and that's been advised by all the authorities, and it's been given by the governors, by more than 25 states have declared that. And it's very important that the best thing you can do as an individual, as a family, is to stay home and stay with your loved ones, and don't expose yourself outside too much unless you have to for some essential things. It's very important that you take care of yourself and your families, and you abide by the governing regulations and rules that have been put out by the local authorities, whether it's your county, your city, your state, and of course the country. There can't be any gatherings in some states of more than 2 to 3 people, in some states more than 10 people. So this is very important that we abide by that, and I think it's crucial now, because we are hearing in the news and we are seeing in the hospital systems that there is a shortage of protective personal equipment, which is the face masks, the mouth masks, the nose and mouth face masks, gloves, gowns, and various other things that are needed to take care of these patients. If you've been looking at news from New York, it's very disheartening. It is the epicenter of the U.S. is New York, and they need a lot of help, and we encourage people to help. I have on the website and down below, Genesis Medical Center COVID-19 resources. We are collecting PPE and sending to different hospitals and urgent cares that need it. We send it as a donation if we have enough, and we also provide them with people that can actually sell it to them at a very low cost. So it's very important to keep that in mind and try to do what you can for the society that you live in. Keeping healthy and keeping focused and keeping a sort of a realistic approach to this. It's very important to keep that in mind. And we're going to take a little 2-minute break, and then I'll be back and we'll talk more about COVID-19 and what we can do to help our localities. My name is Dr. Yama Azar. I am the managing partner here at Genesis Medical Center. Genesis Medical Center is a comprehensive clinic where we provide wellness and preventative medicine to our clients. Mainly, we are in the business of providing stem cell therapies, PRP therapy, IV vitamin therapy, hormone replacement therapy. We treat conditions such as joint disease, autoimmune diseases, neurocognitive diseases. We are one of the only clinics that specialize in these things specifically. We don't do it as a side. The main difference that we offer to our clients is that we plan and make it our intention to educate our clients before they make decisions on treatment. We have time to spend with our patients, and I think that increases the quality of care as well as the quality of compliance. Good afternoon again. We're back live with you here at Shura TV, coming to you on behalf of Genesis Medical Center. Again, it was very important that we display the personal protective equipment. We have the face mask, we have the face shield, and then we also had the gloves, and we have the N95 respirator masks that protect you from 95% of the particles in the air. So it's very important to keep these in mind. This is what a lot of these emergency room doctors need, and they're very short of, as well as gowns and protective gear for their bodies. We've been trying to help supply a few of the hospitals and a few of the urgent cares in and around the area, as well as some in Northern California and some in the Inland Empire near Palm Springs and these areas. If you have any means or any way to help us supply these things, by all means get in contact with us. You can call us or email us at the facility, and we can try to arrange a collection, and then we can try to deliver the goods to the respective hospital or urgent care, or it could be a nonprofit that's in need, that's distributing. It's very important to do that because in this time, as we see, it's kind of mind-boggling what we see. We see that we have, we're living in the 21st century. Here we are in the United States of America, and yet, we're running out of supplies for our basic needs in a hospital. And it's very unfortunate, and the politicians, the suppliers, whoever needs to coordinate has to get on this and make sure that this doesn't happen moving forward. Aside from people staying home and trying to flatten the curve and decrease the number of infections, we really need our hospitals to be staffed properly as well as supplied properly. And we have the biggest corporations running our hospitals, and we have insurance companies that are making billions of dollars a year, and yet at the most basic necessity, at the time of need of people who need health care, and they're at their worst situation, these hospitals are turning them away because there's simply not enough supplies. And this is a tragedy here living in the United States in the 21st century. This should not be happening. We spend so much on our GDP, on our budget, on different government programs, on the military, on foreign aid, on all types of things. Just in January, the Trump administration sent, I think, 17 tons of PPE to China. And when they knew that this was happening here in the U.S. too, it's coming. So it's just mind-boggling on how these decisions are made up at the top. I encourage you to get in touch with your local representatives, whether they're your city representatives or your congressman or woman or your House representatives. Please get in contact with them and let them know what's going on, and that you demand that they get on it and they push for prevalent suppliers, opening the market so that we have enough in this emergency situation for all our doctors not to suffer. I mean, this decision now is costing healthcare worker lives. It's very serious and it's very important. You need to get in touch with your representative and let them know that this is unacceptable. As government officials, they should be pushing to get as much PPE, personal protective equipment, to the frontline doctors as possible and to the facilities. And these facilities need to go ahead and buy these equipments and these things. The other unfortunate thing that's going on is that a lot of these suppliers are being bought out by the government themselves. The government does not have enough supplies. So I know personally of 2 or 3 different situations where a hospital had ordered from a supplier, and then the White House or some government entity came and bought all the supplies out. So this is really unfortunate, where we have bureaucracies and government officials buying these things for their needs through the government system, and yet these private hospitals or all these ERs that we have are not getting what they need. And fortunately, California hasn't reached its peak infection. It's still rising, but there will be a time in 4 to 5 or 7 days, they say, that or possibly in May, where we're going to get the maximum number of infections, and our ERs are going to be packed, our ICUs are going to be packed, and we will need all this equipment. And here we are sitting on April 2nd, and we need to prepare for that. I urge you as constituents of your cities, your counties, the states that you live in, to contact your officials and put the pressure on them. The people have to speak for frontline emergency medicine doctors, for the ICU doctors. We can't have these people getting infected and then not caring for these all the people that go into the hospitals. It's unfortunate. It's analogous to, if you have a war and you're sending your soldiers into the war without protective gear, without the proper equipment. You would not do that. But that is happening right now today in the U.S. And this should definitely stop. We need to provide all our doctors, all our ERs with the proper equipment to face this COVID-19 epidemic properly. And it's up to the people to, raise the awareness. The media covers it from time to time, but they're not consistent with it. It's very important for the people to do this. And I think that with your help and with different organizations, we can do this. Again, if you have any means, if you have ways to donate towards purchasing these things, we can help you with that. You can contact us. We are trying to do our local efforts here, at least in California. And if there are others in other regions that need it, you can reach out, because this is going to be a cyclical thing. It's going to go from city to city. And fortunately, the U.S. is spread wide enough geographically that it's not hitting all the cities at once. So that is a blessing. And, looking at the positive side of things, people are recovering from the virus. They are recovering. Officially, they've had like almost 9,000 people recover, and they're looking at different types of treatment from those people recovered. They're trying to get their antibodies from the plasma and give it to the people that have gotten infected or they're in a bad situation. So they're doing that, and we still have those medications being studied, remdesivir and hydrochloroquine and chloroquine. These things are being studied, and they are being utilized at different hospitals. But now there is a shortage of even those drugs as well. So it's very important that we, come up with some type of supply chain and protect that supply chain, whether it's from the U.S. or not. This is a ridiculous time for people to be saying that, our products should be just made in the USA. We don't have enough manufacturing in the USA. We need to realize that right now. There's a lot of these government entities and entities that are here, and they're saying we need products made in the USA. This is in an emergency situation. Preservation of life is very important, and we need to. Our clothes are made not in the USA. Many of your electronic gadgets are not made in the USA, but you still use them. So now when we need that PPE, we need to get it from wherever we can, bring it in, and flood our hospitals with it, so that this small scarcity and this demand is met. There are people, unfortunately, hoarding supplies as well and selling it at ridiculous amounts of money. This N95 mask, this can be purchased in the U.S. normally. Normally it's about $1.25, or even less if you get a bulk. Right now it's selling for $8 each in the U.S. market. This is very unfortunate, and this needs to stop. This needs to stop. This is unfortunate. Whatever, if you import this from Korea or China or Hong Kong, they make it over there. You can get it for $1.20. Right now, you can still get it. It's just now they've increased shipping costs. DHL, FedEx, and all these companies that do air freight from Korea and from China, they've pretty much increased their prices by 200%. And there has to be someone that has to keep these companies to task, and hold them in this time where doctors in the front line treating patients with COVID-19 need these things. We can't have people monopolizing it and doing this ridiculous thing. So it's very important. These little pieces of surgical masks, normally you get them for 20 to 25 cents a piece. They're going for $1 right now in the U.S. market, and that's the lower end. So this is ridiculous. And these face shields, typically you can get them for 70, 80 cents from abroad, about $1 here. Right now they're going for $5, $6. So it's absolute ridiculousness. And I think we need to reach out to our elected officials and let them know that this should not go on. And again, if everybody in a concerted effort reaches out and raises their voice and lets people know, send the emails. There's many different things you can do, and we have resources on the website that how you can reach your elected officials. You can do that and let them know that this is not right, and you want your emergency rooms to have all the equipment that they need. We had a call from the UC Irvine and the UC system to donate equipment. A lot of people have bought all this equipment and they're hoarding it. All you need is, as a private citizen, is some type of daily use mask like this. You don't need the N95. You just need this when you go out. The CDC has even recommended that if you as a private citizen, you have a little bandana you could put around your nose and mouth when you go out, that should suffice. And you should limit going out. We have another 30 days that they've designated. You shouldn't go out unless you absolutely or essentially have to go. And if you do, then cover your nose and mouth, because there are reports that say that the virus, the micro droplets, last in the air for 3 hours. So there are some reports that are saying that, and a lot of these countries that have kind of defeated or have come out in a better shape, like South Korea, like Singapore, Thailand, parts of Germany, they've done well is because they've used masks or bandanas or something for their mouth and nose when they go out, and they've also done social distancing. So it's very important that you keep that in mind and you practice that continuously, especially when you go to shopping centers and places where there's people around. When I go around, I just assume everybody has it and protect myself. And when I go shopping, the odd times, I'll probably go once a week. I'll go shopping and get things that we need essentially. And when you go shopping, don't hoard. The supply chain in terms of the food is okay and intact. So you can buy some food this week and you'll surely buy more food next week. There's no reason for you to stock up for 4 weeks or 3 weeks or 6 weeks and buy everything out. That's not necessary. So please keep that in mind. We're all in this together. The good thing is, this is not something that has come upon one person or a group of people. It's whether you're rich, poor, white, black, whatever you are, everybody's going through the same thing. And it's a good time for us to be humanly moral and take care of our neighbors. If you have elderly neighbors, you might want to get groceries for them. Check on them, call them, say hi, what's going on? You might need something. There are people that are living alone and they're in quarantine. These people might suffer from, getting some type of anxiousness or depression possibly. Check on people you haven't checked on regularly, and reach out and take care of each other. And hopefully, we'll be through this and things will take a turn for the better. But in the meantime, keep conscious and take care of yourselves and take care of your families and your cities and people around you. That's very important. And if you need anything from us, you can reach our website and reach out. If you have donations to give for PPE, we can take that, and we are supplying different medical facilities with things that they need. We're also buying for them at lower rates that they couldn't find themselves. So, everyone can do their effort, and keep yourself healthy and eat well, sleep well. Make sure you're getting your fruits and vegetables. Make sure you don't watch the news too much. Maybe do 30 minutes, 40 minutes of news a day, and that's it. You don't need to constantly be watching cable news. That'll cause more anxiousness and confusion, and a lot of misinformation comes through that as well. So again, thank you for sharing your viewing time with us, and hopefully you can share and like this video, and we'll see you again soon. Thank you, and have a good day. My name is Dr. Yama Azar. I am the managing partner here at Genesis Medical Center. Genesis Medical Center is a comprehensive clinic where we provide wellness and preventative medicine to our clients. Mainly, we are in the business of providing stem cell therapies, PRP therapy,
IV vitamin therapy, hormone replacement therapy. We treat conditions such as joint disease, autoimmune diseases, neurocognitive diseases. We are one of the only clinics that specialize in these things specifically. We don't do it as a side. The main difference that we offer to our clients is that we plan and make it our intention to educate our clients before they make decisions on treatment. We have time to spend with our patients, and I think that increases the quality of care as well as the quality of compliance.